Hi, and welcome to the Introduction to the Thyroid Recovery Program. This will be put on by Dr. John Erickson, that's me. And we're going to cover today some very vital information regarding thyroid and what are some alternatives that are available out there. A little disclaimer before we get going, all of this material in this presentation is intended as educational only, and it is in regards to your alternative healthcare options that are available to you. The information is not intended to replace your medical doctor. And my approach to care is to treat the whole person and not simply your diagnosis or your symptoms. A little bit about me. I'm a chiropractor by basic training, and I've been doing this for about 15 years. Had a lot of additional education that I've picked up along the way as I've worked at trying to help family members and people close to me and patients. I've studied functional blood chemistry analysis, functional endocrinology, neurotransmitters, and brain degeneration under Dr. Latis Karazian. Also, a very important course which we'll highlight, we'll draw from today, is the Mastering the Thyroid under Dr. Karazian. He studied brain-based therapy with Dr. Michael Johnson, author of the book What Do You Do When the Medications Don't Work? And also studied functional neurology under Dr. Andy Barlow, proficient in many different techniques. And the reason I share this information with you is not to boast. It is simply to help convey to you that what we're talking about today is something that I know. And when we start talking about how we can help people with chronic illnesses, it is based on the fact that I've had a lot of experience and we have been able to help people where perhaps they have not been able to get help before. Many times when I've done this presentation, I've done it in the form of a workshop, and we would ask the people in the workshop, the participants, what were the symptoms that they were dealing with, and after making a list of those symptoms, we would talk about how their current situation was actually ruining their life. And it's actually very emotional as we listen to how people have struggled with these thyroid issues and have been unsuccessful for so many years and have not been able to reverse or undo things to the point that they've watched themselves have to give up hobbies and give up things that they enjoy, have to give up time with family, time with the grandkids, an active lifestyle, whatever it is, as the problem has never been adequately identified, and so things have continued to simply get worse. So here are a list of some of the thyroid symptoms. If you are a thyroid sufferer, these are not going to be new to you. Some of the big ones are probably going to be fatigue, weight gain, constipation, diarrhea, sensitivities to temperature changes, dry brittle hair falls out easily, slow wound healing, a variety of different things. Now in the workshop, what I would also do is I would identify how long people had been struggling with these, and it was not uncommon to have people attend my workshops who had been dealing with thyroid issues for over 30 years. And sitting right next to them may be somebody who was just recently diagnosed with a thyroid problem, or they haven't even had the diagnosis. They are just suspecting, according to the literature and their symptoms, that might be their problem. The sad thing is, though, is that as they sit in those workshops, these who have not had thyroid for very long, they very quickly begin to realize that I'm sitting in a workshop with another woman who's had this for 30 years, and I'm listening to her tell me that she's done the bioidentical hormones, she's done the dietary changes, she's done the Thyroid, she's done all of these different things, and she's still struggling with it. She's not any better. And so it's almost like there's this realization that, wow, that's going to be me in 30 years. And the reality is, when we look at it according to our current medical approach, our current approach and understanding of these things is that you do not get better. When you talk to the doctors and they put you on these medications, Synthroids and thyroid replacement hormones, it's not with the intention to get you off at some point. It's to manage your problem for the rest of your life. And even though your blood work may come back showing normal values because you're on the medications, they don't really have a solution for all of the other symptoms that you're dealing with that we went over earlier. Except what? More medication. Now I want you to understand that there are actually 7 pathways that can lead to thyroid problems. And only one of these pathways is actually helped by medications. Now upon hearing that, you should have said, wow, you mean that there are multiple ways that I can develop a thyroid problem, but only one of these ways can actually be helped with medicine. Yes, that's what I'm telling you. That means that you could be one of the other 6 pathways dealing with a thyroid problem, and you're still going to get the medication because the treatment protocol is the same for each one when we look at it allopathically. So even with the best case scenario with medicine, you're looking at maybe a 17% success rate. Now, a lot of the current ways of dealing with thyroid were established 50 years ago, and we're still, and I say we, in our current healthcare society, we're still treating it the same way. And that's if you have a high thyroid, or if you have high TSH, we put you on thyroid hormones. Thyroid hormones have the way of burning out the thyroid. Eventually you're going to have, the thyroid's going to shut down, it's going to quit working, you're going to have to be on these things for the rest of your life. These are the approaches that we're dealing with right now. Okay, what I'm going to talk to you about today is what can be done now in 2012. We do have a better understanding of it. It is an alternative approach, but it works. It really does. Traditional typical thyroid tests are ordered are TSH and maybe T4, which is thyroxine if you have a little more of a progressive doctor. But those are the only ones that are evaluated, and you cannot fully evaluate the thyroid if you're just looking at a little piece of the puzzle. So everyone is trying to fix the symptoms, no one is trying to fix the problem. And I tell my patients, you do not have a do not have a thyroid problem, you have a health problem. We need to fix you as a person, as an individual, and not just simply chasing your symptoms around. Because in our current healthcare methodology, we consume tons of medication. That's how we do it. We make up 5% of the world's population, yet 47% of all medications in the world are consumed right here in the good old United States. And the only effect of those things is to put a Band-Aid on it. It's to cover up your symptoms. In just a bit, I'm going to go through several areas of the body that can be impacted by poor thyroid function. And if you can imagine just how many drugs you would be taking as each of these different areas were becoming tied into the overall degeneration or decline of the overall health of the body due to the thyroid. I'm going to refer back to Dr. Karazian again. He wrote the book, Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? Great book. I recommend you finding that. It is currently, the first printing is done and over with. They're looking at a second printing now, but I'm sure you can still pick one up somewhere. So the thyroid supports all of these different areas of the body, and so every portion of the body is impacted by thyroid function. And so when the thyroid is not working right, potentially anything could happen. The thyroid affects metabolism, and that's kind of going to be a main theme as we go through these different ones, because metabolism is the rate at which your body can actually use energy and it functions. And so if you can picture a car slowing down because it does things, the battery's not working like it's supposed to, or there's not enough gas in it, and so things are slowing down, it's going to impact everything. And so bone metabolism is going to be impacted by that. What does that mean? It means that the bone is not going to be regulated like it's supposed to. So you may have more porous or thinner bones or weaker bones as a result of a thyroid problem. Gastrointestinal function, that's your gut function, it's going to be subpar. It's not going to work like it's supposed to. You're not going to be able to produce enough of the acid that you need to break down food components and absorb nutrients and fight off infections. And so you're going to find some sluggishness, perhaps constipation, diarrhea, heartburn, acid reflux as a result of that. Male reproduction. Now, we don't see as much hypothyroidism, low thyroid function in men, but it does need to be ruled out because it can be a source of low sperm counts, loss of libido, impotency with men. When your metabolism and everything slows down, liver and gallbladder function is going to slow down as well. Now, your liver is your main detoxifying organ of your body. It is supposed to clear out old hormones. It's supposed to clear out the junk, break down drugs, so everything can be gotten out of the system so it doesn't linger and hang around. And critical to that is the gallbladder function, as it takes these different poisons and whatnots and puts them into the digestive tract so that they can actually be eliminated. And when we have this going on, low thyroid function, we're going to see poor gallbladder, sluggish gallbladder is going to slow it down, and poor liver function as well. Fat burning is also going to be an issue. This is probably going to be more critical for the women in that you'll have a situation where it does not matter how low calorie diets you eat, it does not matter how many hours you log on the treadmill, you're just not going to seem to lose that weight. And it's a huge problem for these women because they try so hard, and yet they're tired and they're run down and they're forcing themselves to work on this, and they have so little success. Right here you can actually kind of see the progression. When the thyroid tends to be the major problem contributing to the weight gain, we tend to see weight that is all throughout the body, not just located to one area. Glucose and insulin are also going to be impacted by this. Glucose is essential for body cell function, and your body is just going to become more resistant to the utilization of insulin. and it's also going to be not as prone to use sugar as a source of fuel, which is going to lead to more lethargy and tiredness. And it's going to cause a situation where you may have low blood sugar, which is called hypoglycemia. Low blood sugar symptoms can be craving for sweets or irritability if meals are missed, lightheaded if meals are missed, feeling shaky or jittery. And then when you eat, it's like you pop out of it. It's like you just took a nap and you're feeling better. Also, another, kind of at the other end on the blood sugar is what we call insulin resistance. It's where we've got too much blood sugar, but the blood sugar cannot get into the cells for proper functioning. And so symptoms here would be fatigue after you eat the meal. It's kind of like the food coma, they may call it. General fatigue, constant hunger. You may have a craving for sweets after your meals. Since we're on the topic of blood, let's talk a little bit about analyses that come in, your blood work. Your blood work has, when it comes back to you, has some ranges that are established by the labs. We call these lab ranges or pathological ranges, and the purpose for calling them pathological, meaning that they're very broad, and that if you fall outside of these very broad ranges, then there's a very good chance that you have some type of a pathological issue going on. However, these ranges do not reflect what optimum would be, because they are so broad. And they're established by averaging out the blood work that comes through their particular facility. So all of these sick people, because sick people are usually the ones who get their blood work done, they come through, they get their blood work done, they average out these numbers, and they establish these ranges now that are supposed to represent where we're supposed to be. But the reality is they're normal for sick people, if you catch my drift. So talking just briefly about some of these, we call an optimal range more of a functional range, and then we have the pathological ranges. So TSH, thyroid stimulating hormone, your traditional high and low ranges for that are 0.3 to 4.5, and that was recently adjusted and changed down to from 5.0. So you'll see that these change, which is another indicator that perhaps they're not optimum. The functional range for that's 1.8 to 3.0. Okay, that's where we should see that TSH range falling. And if you go into your doc and you get your blood work done and it comes out at 4.2, he's going to tell you that everything is hunky-dory. It's great. Not your thyroid. It's looking good. I'm not sure why you're tired, why your hair is falling out, why you can't lose weight, but your thyroid numbers are great. But the reality is, if I were to look at that, experience has taught me that I would consider that probably in a hypothyroid situation, we need to be doing something about it now, because before it becomes more of a pathological thing. So as you can see here, we have numbers for glucose as well, cholesterol, triglycerides, and the reality is we've got some functional values for just about every blood marker that's out there. So I've had patients come in who have had blood that they have been told is normal, and I can pick that apart and actually find 4 or 5, half dozen different things that are less than optimal. And when we're talking about creating health, you want optimal health. Brain chemistry is going to slow down as a result of thyroid, and so you'll find that you're just not as sharp. Brain fog, fogginess, you can't multitask like you would like to. Depression, moodiness, all of these things can be as a result of the thyroid not working like it's supposed to. When estrogen is utilized in the body, it's the liver's job to break it down to a form that can be excreted and gotten out. That form actually becomes very more of a sensitized form, meaning that if it is allowed to recirculate again, it's going to increase your risk for uterine cancers and breast cancers and other types of female cancers. And so a properly functioning liver, properly functioning thyroid can actually help to be preventative and hold down your risk of getting these types of female disorders. And the reverse is true. Poor functioning thyroid, poor functioning liver, you can actually have more of these problems. Stomach acid production, touched on this one earlier. With GI health, as the thyroid slows down, metabolism slows down, the body's ability to produce stomach acid and digest and break down food is going to be compromised. Over here, protein metabolism, this one is broken down with high acidity in the stomach, protein is, and so with a lack of that, you're going to get proteins that aren't broken down sufficiently. You may get really bad smelling gas, you may have sour stomach, upset stomach, poor digestion. This is going to lead to infections in the gut. Body heat and hot flashes. Your thyroid is basically the thermostat of the body. It sets the temperature, and when the thyroid's not working right, it's going to have a second domino effect, going to topple over, and it's going to begin to affect the female hormones as well, leading to problems with heat surges, night sweats, hot flashes, and things of that sort. Progesterone production is another one. In the case of progesterone production, this one is going to influence some of the hormones that are actually functioning in the thyroid and some of the enzymes, and so it actually kind of feeds back into this. And so not having The thyroid working right is going to affect progesterone function, which is going to feed back, and it's also going to affect the thyroid again. But this one also is going to play a role in PCOS, polycystic ovarian syndrome. It's going to affect causing heavy menstrual bleeding, inability to lose weight, depression, headaches, and other symptoms that may fall within the middle of your cycle, including higher risks of infertility and miscarriage. So the hypothyroid can lead to anemia, which is the body not carrying oxygen like it's supposed to. Bad situation. It's going to impact overall healing. It's also going to impact heart disease in the form of homocysteine, which is a chemical that, if it is not adequately broken down inside of the body, will increase inflammatory rates and actually impact the heart, brain, other areas of the body as well. When I'm looking at and evaluating somebody, there are 5 deal breakers. Okay, and I call these deal breakers because if you have any one of these 5 existent in your body, your effort at trying to get to where you'd like to go, to the finish line of better health and feeling better, it's going to be severely impacted. The very first one is autoimmune. Okay, 70% of the people out there have an autoimmune condition going on, and it's like the bully in the playground. It's out there causing a ruckus, it's messing things up, it's causing all sorts of symptoms, yet too often we're chasing after the symptoms and we're not actually affecting or going after that bully. Okay, how do you know if you have an autoimmune condition? There are tests that you can run, which are going to be more conclusive. But if you have situations that have, health issues that are kind of up and down, they ebb and flow, they're difficult to treat. I had it for a while, it went away, now it's back. Nobody really seems to be able to find the problem, what's going on. I've taken lots of vitamins and it doesn't help. I've taken different medications and it doesn't seem to help. There's a good chance that there could be an autoimmune issue going on, and that basically, autoimmunity means your body has turned upon it, attacking itself, and that's not a good thing. Blood sugar, touched a little bit on that, but if we have a blood sugar problem, it's the #1 metabolic stressor in the body. So if you have blood sugar imbalances, they're not in optimal ranges, and again, I stress those functional values, not just the pathological values. It's a deal breaker. Anemia, your body needs fuel in the form of oxygen and sugar. And if you cannot deliver oxygen to the body like it needs to, it cannot heal. So anemia is going to be a problem with that. Gastrointestinal and liver. If we cannot detoxify and keep the body clean, if we cannot break down our food and absorb nutrition, we cannot get well. Fatty acid metabolism as well. If we can't handle some of these fatty, good fats, and we don't have enough of them in our diet, and we can't handle them appropriately, then our body cannot heal and regenerate like it's supposed to.